Hello, my name is Patrick Brown, Mayor of Brampton, and welcome to our weekly COVID-19 update. Today I'm joined by Dr. Lawrence Lowe, who is our Medical Officer of Health for Peel Region. I'm also joined by Paul Morrison, our Commissioner of Legislative Services and our Director of Bylaw Enforcement, as along with Regional Councillor Rowena Santos, who will be making a statement on anti-Asian racism, and Councillor Gurpreet Dillon, who will have a bylaw update. So I want to start with vaccines. We've seen the supply starting to increase, and that is helpful. And I want to acknowledge the province for yesterday's announcement on Phase 2 of the COVID-19 vaccine distribution plan. Pretty much all of Brampton is a hotspot, and so for those residents who are 50 years and older, living in select postal codes that happen to be our city, you'll be eligible for vaccines. And so that's encouraging news that we'll have more residents who are eligible for vaccines. I'm also pleased to share that yesterday the Region of Peel opened its newest COVID-19 vaccination clinic at the City of Brampton's Chris Gibson Recreation Centre. The city is looking at any way to support Peel Public Health's efforts and made this recreation centre available. The centre is located at 125 McLaughlin Road in Brampton, and residents can learn more and how to book their appointments online at the Region of Peel's website. I also want to note that I know it's a difficult time, and as we hear of new restrictions, I know the public is frustrated, but we have to take this third wave. I also wanted to share my concerns about the vaccine rollout. Since Canada got vaccines, we have approached it as we have to be equitable across the country. We have to be equitable across the province. And the reality is, this virus isn't equitable. This virus isn't fair. This COVID-19 virus and its variants attacks densely populated areas different than it does rural areas. And so when you're densely populated, you see transmission at a much greater rate. COVID-19 in factory settings is much more dangerous than it is in a public sector setting. COVID-19 the reality isn't an equitable virus. It isn't fair. And we're seeing that some of Canada's hotspots, unfortunately, are really struggling with this virus. And I think the vaccine rollout needs to recognize that. We need to attack where the fire is. These vaccines are fire extinguishers. And right now we have a fire in Toronto and Peel, and we need those vaccines to protect our public. And so let me give you an example of how the current rollout doesn't work for the City of Brampton and the Region of Peel. An area that had a very well-known outbreak was Amazon, over 600 cases. And at Amazon, the average age of a worker there is 35. So despite the fact we're lowering the threshold to 50, that's not going to help with outbreaks we have in Amazon or other logistics companies or other food processing companies. My message is very straightforward and very simple to officials at other levels of government, whether it's the Government of Canada that controls the supply or the Province of Ontario that sets the prioritization. Vaccinate essential workers. Vaccinate essential workers. Vaccinate essential workers. We're ready. We are ready to do that immediately. The Board of Trade, the Brampton Board of Trade, actually put forward a proposal to vaccinate the food processing workers on site. They were going to set up their own apparatus to vaccinate the food processing sector, where we've had a number of outbreaks on site. I know the logistics sector has said they're ready and willing. Amazon officials actually told me that if they can deliver a package in 2 days, they could have a vaccine clinic set up in a day. They said they're good at logistics. There's no reason we can't get vaccines to these essential workers. We know where the outbreak is happening. We just need the will. And where there's a will, there is a way. And I'm really hoping that we're going to see a change in how we're attacking this virus, recognizing that if you protect Peel and Toronto, you protect the rest of the province and the rest of the country, because this spread, the rate of transmission, is leading out into other regions. And so my plea my plea is we must use this time right now during this lockdown to vaccinate our essential workers, because the same old approach isn't working. To think that we can continue down the same slow approach and things will be different a month from now, it's not going to work. I don't want to be in a continuous lockdown for months and months, and if we don't focus on where the fire is, we don't focus on where the spread is, we're going to be in the same predicament. And I think that highlights my frustrations with the current vaccine rollout. And on that note, I'm going to call up Councillor Rowena Santos to share a statement on behalf of our City Council on anti-Asian rhetoric that unfortunately has been part of the public discourse more recently.
Thank you, Mayor Brown, and good morning, everyone. In January last year, as the COVID-19 virus started to spread globally, anti-Asian racism became more prominent. At that time, Mayor Brown and my council colleagues, together we toured Asian businesses to show our support. But sadly, over the past year during this pandemic, anti-Asian sentiment has worsened. Most recently demonstrated in the shooting in Colorado, recent hate graffiti across the GTA, and an increasing presence of social media comments targeting the Asian community. I personally experienced this a couple of weeks back when someone was publicly prompting online bullying and justifying racist comments. As the first Filipino elected in Peel Region, I received numerous calls and stories from the community, and particularly from our young people. Daniela, a young Filipina from an organization called Filcasa, reminded me that being raised in Brampton in an Asian immigrant family, we feared racism. But we kept our heads down and just focused on working hard. We didn't want to cause trouble, so we remained silent when people made racist comments. Brampton has now grown to over 73% visible minorities. The Asian community in particular is one of the fastest growing communities, and it is time for us to call out such unfair and racist behavior. I'm proud that our Brampton Council will be ratifying a motion today to be in solidarity against anti-Asian racism. As one of the most diverse cities in the country, we oppose all forms of racism and hate. I would now like to share a message from our Asian youth, which they have shared with me. We are not your scapegoat for frustration. We are essential workers. We are the people who keep grocery shelves stocked. We are nurses. We are doctors. We are teachers. We are leaders. And we are your neighbors. We are not only being faced with heightened racism in the public domain, but we are also victims of structural racism with inequitable access to healthcare, vaccines, and sick days. As a community, we will keep working very hard, but we will also speak up and call out racism for what it is. And we are asking all of our allies to do the same. Thank you so much for allowing me to share this message, and thank you for the opportunity, Mayor Brown. Back to you.
Thank you, Councillor Santos, for that very clear message on behalf of our City Council that we stand against anti-Asian hate. Before I call up Councillor Dillon, I just wanted to share the hospital numbers. I've got an update from the William Osler Health System that are really starting to be challenged right now by COVID-19. I believe the William Osler Health System now has more COVID-19 patients than the COVID-19 hospital that was set up, and so it speaks to the challenging dynamic in Peel Region. There are currently 53 COVID-19 inpatients at Brampton Civic alone, 11 in ICU, 27 patients who are awaiting COVID test results. To date, Osler has administered 57,000 doses of COVID-19 vaccine, with 1,500 vaccinations taking place per day, and that's on top of the vaccinations that Peel Public Health undertakes as well. Osler has provided 390,000 COVID-19 tests since the beginning of the pandemic, so they continue to focus heavily on testing so we know where the virus is in our community. So on that note, Councillor Gurpreet Dillon will share a bylaw update on our efforts to follow the public health protocols.
Good morning, everybody. Thank you, Mayor Brown. I'm pleased to provide an update on the city's bylaw enforcement activity. First, thank you to our community who continue to demonstrate their commitment to keeping our city healthy and safe. Between March 29 and April 4th, 4 charges were laid under the mandatory face covering bylaw, and 17 charges were under the Reopening Ontario Act. 12 of the charges laid under the Reopening Ontario Act are from 2 separate residential gatherings. Many thanks to our bylaw team that continue to operate to keep residents safe and get us on track to reopening our city and our economy. As the warmer weather is upon us and people are looking to get outside into public spaces, I want to highlight our local Brampton cleanup campaign. In past years, the City of Brampton hosted 2 major cleanup events annually, one in the spring and one in the fall. Going forward, there'll be one self-led campaign where residents are encouraged to do their own cleanups from April 1st to November 1st at a time and place convenient to them. This year we'll also be recognizing the Provincial Day of Action on Litter on Tuesday, May 11th. Brampton is a green city, and our council is fully committed to that goal, and we're committed to keeping our home clean and green. From April 1st to November 1st, take a few minutes to clean up anywhere you like around your home, in your local park, in front of your house, or your business. If you collect recyclables during your cleanup, please remember to recycle them. For more information, you can email bramptongreencity@brampton.ca or visit brampton.ca/cleanup, and I'll ask the mayor to come back up.
Thank you, Councillor Dillon. On that note, we'll now hear from Dr. Lawrence Lowe, our Medical Officer of Health for Peel Region.
Thank you, Mr. Mayor, councillors. Good morning. Just grab hand sanitizer. Thank you. First of all, I'd like to wish all of our residents a happy World Health Day. April 7th was the founding of the World Health Organization and is the day of the importance of health. This week in Brampton, our test positivity is at 15.9%, which is up from 12.2% last week, with the weekly incidence rate at 287.4 cases per 100,000, which is significantly up from 174.5 cases per 100,000 last week. Demand is threatening to overwhelm our hospitals and intensive care units, and in addition to the numbers that Mayor Brown shared at William Osler, we also note that patients continue to be transferred out of Brampton across the province, far away from home. They are often younger, sicker, and in hospital for longer, and we would be very challenged in our region if hospital transfers were not a possibility. Our 7-day average of new cases is now at the peak of our second wave, with no sign of relief for contact tracers or our hospital and healthcare workers. However, as I had mentioned in February, keeping us in strong measures in Peel largely delayed our case resurgence. We saw as other jurisdictions across the province raced out and reopened, only to return to the emergency break and now this province-wide shutdown. It is clear, however, in the past couple weeks that those measures are no longer holding, and that the variants have very much won this round in Peel and in Ontario. And while schools remain safe when strict measures are in place, those measures have a threshold where they become fraught and less effective. This was reflected in our recent decision to move to online learning across the region, announced on Monday. As a parent, I know that it was sudden and very stressful, and I regret any inconvenience, but we had to make the most of the gap between the Easter holiday and the April break to reset and ensure the continued safety of in-person learning in our community. Moving to online learning now will hopefully allow us to gradually reopen schools sooner, though it will be gradual and very dependent on how we control this third wave. To that end, I'm asking everyone to do 2 things. Firstly, if you are eligible, get the vaccine. Please protect yourself, your loved ones, and your community. You can visit peelregion.ca/COVID-19 vaccine to learn about eligibility and to book at any of our community and hospital sites. To date, Peel Public Health with our hospital partners have administered over 200,000 doses of vaccine, including coverage for almost 70% of our 80-plus population. On Friday, at our hospital and community sites, We will start booking appointments for residents who are aged 50 and older. And at Regional Council tomorrow, I will release a full schedule as to when each age group can anticipate to be vaccinated through mid-May. I want to be clear that moving quickly down the age brackets will be the fastest and most effective way to ensure that we get Peel vaccinated in the least amount of time. However, even if we vaccinated everyone in Peel today, we would still not see changes in our trends for over 4 weeks. That means the second thing that we all need to do right now is to stay home as much as possible. Again, reduce contact and interactions with people outside your household, and if you must meet, do it virtually or stay outdoors, distance, and always wear a mask, and do not meet if you are feeling unwell. If you're feeling unwell, get tested and self-isolate. COVID-19's variants are spreading faster than before with quicker and more symptoms. I do want to thank Mayor Brown and Council for their strong support of vaccine allocation for our region and essential workers, knowing that moving down the age groups even more quickly is the fastest way to protect these individuals in our communities. In the meantime, however, we still need measures like paid sick days and targeted protections in workplaces to keep people safe. Other countries that have received vaccine before us have shown us the path. They closed as they vaccinated, and then they began to reopen with confidence. We can do that here too. It will save lives and help us exit this cycle permanently. Thank you, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe. We're now happy to take some questions. First up is Jennifer from CP24.
Hello, good afternoon, Mayor Brown. This is a question for you and Dr. Lowe. Now, the province is expected to announce a stay-at-home order that would see new restrictions, including the closure of non-essential stores. Do you support this?
I absolutely support the closure of some non-essential stores. I look at the essential list, and it's been so vast that during many of the lockdowns, there were so many factories that were exempt that the majority of our workforce was still going to work. You know, it made me scratch my head that so many big box stores, international companies were running unabated during lockdowns. And so I think a stricter approach to what truly is essential would be a smart step, because we know where the outbreaks are happening. They're happening in many of these essential workplaces. And if Dr. Lowe wants to add his perspective as well.
Yes, thank you, Mayor Brown. As I said in my remarks, the variants have won this round of the race. We need to close. We need to reduce restrictions. We definitely, as Mayor Brown said, also need to really look at the overall essential business list and what we can do there, as I mentioned in the letter that I penned with Dr. Etches and Dr. Davila. The reality is that other countries that had vaccine before us have done this as well. They closed and vaccinated, and then once they vaccinated, they are now reopening with confidence. You can see it in other countries that they are done with COVID. And so if we want to protect our hospitals and our healthcare system, this is our last chance of hope, and this is our last chance to make sure we get this right, the last closure, and then start to vaccinate our way out of this. But right now, the variants are basically in control, unfortunately. Thank you for the question.
Is there a follow-up, Jennifer?
Yes, there is a follow-up question. It's for Mayor Brown, and perhaps Dr. Lowe might want to chime in. Mayor Brown, you alluded to the fact that vaccinating essential workers that work at factories is a high priority, and Dr. Lowe, you said that moving down the age groups quickly is the key to ending this virus. Do you anticipate that Peel region will move quicker than other hotspots over this shutdown period that's expected to happen?
Well, I hope that the hotspots will be given the highest priority for vaccines so that we can vaccinate essential workers. And earlier today, I had a conversation with Dr. Lowe that even our bylaw officers aren't on the prioritization list right now. So we've got essential workers who are going to the locations to make sure people aren't transmitting COVID, and they're not even vaccinated. You know, the calls I'm getting, whether it's from our educators, whether it's from factory workers, food processing, transportation, logistics, the list goes on and on. People begging for vaccines. If we had vaccines, then we could be out there vaccinating. And so I really hope that the prioritization schedule is amended to allow public health to undertake this critical project, and that the vaccines are made available. And Dr. Lowe, if you'd like to speak to that as well.
Yeah, thanks so much for the question. I think it certainly is a multi-pronged approach, and in my comments I've made very clear that the backbone of the system still remains our mass immunization clinics, and it's certainly with more supply, the ability to move efficiently and quickly down the age groups will allow us to get a larger proportion of the community covered as needed. But certainly to Mayor Brown's point, we also do continue to have mobile capacity where it makes sense. We will be out there and vaccinating together with our provincial colleagues. But to be clear, if we're getting needles into arms, you have the option of either bringing needles to arms or you can push those arms towards needles. We have clinic capacity that is ready to go with allocations that are continuing to be rolled out. The sooner we can unlock age groups and continue to move further down, the sooner we will get down to vaccinating 50, 40, whatever, 30, and eventually it'll be 20. And then at that point, everyone, regardless of their status or regardless of what they're having, will be able to get vaccinated. So continue to move down the age brackets and then targeted mobile approaches as needed to support our essential workers. Thank you.
Our next question is Shauna from City News.
Good morning. My question is for Dr. Lowe today. So if the province did the stay-at-home order, shut down the non-essential retail, restricted big box stores last week or even a couple of weeks ago when we knew that these variant cases were rapidly rising, do you think that schools would be open to in-person learning today?
So I can't really speak to a situation that's modeled in retrospect, Shauna, but I think I've been very clear throughout the course of this pandemic. We needed to reopen gradually. We needed to make sure that we were still limiting our contact and interactions to the extent that I think back in February I highlighted that nobody wanted to see a third wave. Nobody wanted to see a third closure. This really speaks to the cautious approach that we took in Peel, the fact that our resurgence came later than the rest of the province in other places that had loosened restrictions. And I think the only thing I can say, and I think of what my parents always said when I was growing up, haste makes waste. Like essentially this is to some extent just part of the challenge where if we're all rushing out to reopen and relive our lives again, COVID will very quickly remind us that it's still around. Thanks so much.
Okay, I still love your thoughts on this, Dr. Lowe. Just the fact that, you had to take the drastic measure of shutting down schools before the province even took the measure of shutting down malls or IKEA, for instance. And everyone is saying that schools should be the last to close. So do you feel that the province, or is the province, putting the burden of what to do with schools on the shoulders of, the public health units?
I honestly think the province has a very difficult job, and they're looking out for the entire province of Ontario, whereas I have to speak to the community picture I was seeing. At the threshold of cases and the transmission we were seeing there, like I said, the measures are only effective up to a limit. At some point, those measures are increasingly become somewhat ineffective, and they no longer inspire the confidence. So that was why we took the decision we did on Monday. It's specific to the Peel picture, and I think the province is making their decisions based on what they're seeing as well. Thank you.
Okay, Steve from in Brampton.
Good morning. Question for Dr. Lowe. Excuse me. And the question is, there seems to be a bit of a shift in policy to vaccinating the warehouse workers as opposed to vaccinating people by age. Is that the case, and why so now?
So, Steve, like I said, actually, it actually is both parts of the strategy. We do need to keep moving through ages very quickly because that is how our mass vaccination clinics are set up. And we have seen, for example, just in the last 5 days, we've been doing 5,000 people a day at our mass vaccination clinics. So if we keep dropping age brackets, we'll quickly get through everyone. And that covers off people with chronic conditions. That covers off people with, essential worker status. The quicker we can get through, that's going to cover a bunch of our population. But I am supportive as well, and we are certainly in discussions with the ministry around how can we do targeted mobile strategies in some of the higher risk workplaces and settings. So it really is both. It's two parts of a whole. You need to keep dropping the ages and pushing people to mass clinics, and you need to have those targeted mobile strategies to support essential workers. Thanks for the question.
Thank you. The next question is, are enough people coming forward in Peel Region to get vaccinated? On the dashboard, it looks like they're averaging 8,000 people a day, and it's set up for more than that. Are you satisfied with the number of people coming forward?
there is no shortage of people wanting to come forward to get vaccinated. The issue is vaccine supply. You know, we have literally every day lists of people writing us asking for vaccines. Do we have a capacity to vaccinate a lot more than we are right now? Absolutely, but we have to be a lot of more vaccines to be able to do that. And if Dr. Lowe wants to speak to that as well.
Yeah, thanks, Steve. In general, what we see is that as we move further down the age brackets, there is tremendous demand. A lot of people start. For example, we opened 60 plus on Friday, and our clinics have been full. Our entire clinic system has been full. 8,000 a day is essentially what we're doing right now. But we are planning to ramp up and continuing to ramp up to more to meet demand. But I really think I would echo what I've been saying. If you are of an eligible age group, peelregion.ca/COVID-19 vaccine. It'll answer your questions. It'll tell you about eligibility, and you'll be able to book an appointment there. Thank you so much.
And just on that note, I should reference that I've seen some comments asking about is there wasted vaccines at the end of the day because of people not coming forward. That's not the case in Peel Region. Dr. Lowe can attest, we don't waste vaccines here. We have people eagerly waiting to have them put in their arm. Sabrina from the Mississauga News.
Hi there. So my first question is for Mayor Brown. So I just want to go back to your frustrations about the vaccine rollout. I know Peel Region was promised first access to vaccines because we are a hotspot. I'm not yet sure if that has been fulfilled. However, in your opinion, why hasn't Brampton in particular been given priority?
So I think the equitable rollout of vaccines has been an error in the pandemic response. Every province has been given an equal amount per capita of vaccines, and across Ontario, the initial plan was to have an equitable rollout of vaccines. But if you're a fire chief and you get called there's a fire at a house, you're going to send the fire truck to where the fire is, not a block away. And unfortunately, this virus doesn't work in an equitable manner. It targets the densely populated areas. It targets the busy factories. And so I do hope that we're going to start to see a prioritization for the hotspots. When we're looking at it, we have 20% of the province's COVID cases, but 10% of 10% of the population, 10% of the vaccines, and that's not working. We're losing the battle against the variants because we don't have enough vaccines. And so I'm a broken record on this. We need vaccines. We need vaccine supply. We need to target our hotspots.
Thank you. Okay, so my second question is for Dr. Lowe. So in your opinion, besides enacting the stay-at-home orders, moving schools to online, and lowering the age for vaccinations, what else can the province or the region do to see our numbers start to move in a more positive direction?
Well, I think, certainly to the extent that those measures can be applied across the province or at least across like a broader regional approach, that would be important. I think we saw specifically in Peel, one of the challenges was we had people that were traveling to areas that had looser restrictions, contracting COVID, and then being counted in our case counts subsequently. So the decision taken by other jurisdictions in the Greater Toronto Area to have looser restrictions was keeping us in lockdown. So I think, you need to have a regional approach that will discourage region hopping. You also need to have a real close, hard look at that essential business list. There are a lot of places that continue to remain open, and they continue to, I think we can all debate and argue whether they're essential. And I think there's a need for us to really take that seriously, as Mayor Brown says, until we can actually ensure that we get down the age bands or have a targeted strategy to vaccinate them. It's really vital that we ensure that we limit contact interactions with people outside our household, close down, vaccinate, and get out of this permanently. Thanks so much for the question.
Okay, our next question is Nikki from the Bramptonist.
Good morning. This question is for Mayor Brown. We are under, once again, a lockdown, and there are those who are asking for even greater measures to be implemented, despite the devastating impact lockdowns are having on our economy, our children's education, and people's mental health. You've said the vast majority of Bramptonians are law-abiding by government's direction, but with variants spreading quickly and stricter measures coming, do you not think or worry the constant change in messaging is undermining public confidence in government direction?
I do think having different rules in different parts of the GTA is confusing, and the constant changes does confuse the public. It's why by law, when they're out educates first before they issue fines. We're trying to work collaboratively with the public that may not be watching the news on an hourly basis to see what the latest rules are. I would say hopefully today at the provincial announcement there'll be more clarity and consistency across the province based on the announcement. But we'll learn about that in a few hours.
Thank you. My next question is for Mayor Brown also. What can you tell Brantonians who have made sacrifices, who have abided by your direction? They're suffering serious hardships to tighten their belts just a little longer, only to find out the circle keeps repeating itself.
Well, and I would say there are, I know we're in a tough situation right now with the variants really spreading fast, but there are better days ahead. If you look at the vaccine schedule, Canada is going to be getting millions and millions of vaccines. And so I think Canada was slow to the mark in getting vaccines, but if you look at the delivery schedule, it starts to get a lot better in April and May. And so as we vaccinate the public, we're going to see the dynamic change. And you've seen countries like Israel that is almost fully vaccinated, the dramatic change it means. It means that we slowly get back to normal. And so there are better days ahead. And it's encouraging to know that our most vulnerable in our community have already been vaccinated. As someone that has a loved one, my grandmother who's in a long-term care center, knowing that those centers are now protected, they're all vaccinated, that's an example of how we're in a better position than we were a few months ago. The vaccine rollout is the game changer. They're critical. So we have time for one more question because City Council is about to start. I'm going to go to Nitin Chopra. One question for you before we have to start our City Council meeting.
Thank you, Mayor Brown. Mayor Brown, my question is to you. As you said that your words highlights the frustration when you say vaccine, vaccine, vaccine. We can see similar frustration with Premier Ford when he says that I can go to US to get the vaccine. Why don't we see that frustration on Prime Minister Trudeau? Because Minister Anand said we have enough vaccine in the country. So where is the issue? What is the issue when Minister says we have enough vaccine and province and city says we need vaccine, vaccine, vaccine? Where is the issue?
We don't have enough vaccines. If we had enough vaccines, we'd be vaccinating all age groups like they are in the U.S. In terms of, they're saying there's no supply issue. That's just political spin. I know it's not public health choice to say we're not vaccinating bylaw officers, not vaccinating educators. I know if they had a supply, it wouldn't be choosing between worthy categories. It's a horrible situation to be in for public health officials deciding, do you protect a senior citizen or do you protect a frontline educator? Do you protect an essential worker or do you protect a frontline law enforcement official? If we had enough vaccines, you wouldn't have to make those false choices. And so whatever spins coming out of Ottawa that there's not enough, that there is enough supply is hogwash. There's not. We've got worthy groups that still don't have vaccines. And on that note, Nitin, we have to close this weekly press conference because we are completely out of time and I have to start our City Council meeting. So on that note, everyone stay healthy, stay safe, and we look forward to next week's update. And hopefully, like I said, there's better days ahead once we get through this third wave.